Another area in the vascular laboratory that we have here when we perform ultrasound testing is looking at a different set of blood vessels, particularly in the neck area, called the carotid system. And the reason that someone would want to take a look at the carotid arteries is if somebody comes in with a risk for developing stroke, which is one of the leading causes of mortality in the United States. The American diet and the American lifestyle oftentimes lends itself to the risk actually of developing these problems. Is why it's so common. And yet these things are preventable. And stroke used to be the third leading cause, and now it's the fifth leading cause. And it took a while to have improvements. And so going from the third leading cause of mortality to the fifth is actually quite a jump, because we're talking about large numbers. And one of the reasons that the trend toward stroke being less likely to be a major cause of mortality is because of prevention. And one of the ways we have been able to prevent these problems from happening is with ultrasound testing of the carotid system. My belief is that we don't want to wait for a stroke to happen in order to then perform the test and say, aha, this is why we had the stroke, because a stroke is a permanent neurological condition. And so it's really important that we examine the patient and really take an aggressive approach in seeing, well, what are the risk factors that are present? How are we going to know whether a patient is going to have a stroke or not? And these things are very difficult to know. So the clinical suspicion from the physician is really what that comes down to. If you don't look, you're never going to know, and until it's too late. And I think that's really our approach. We have the technology, we have excellent technicians, and we do great work. And the images that we obtain, they're crisp images, and it makes me proud to have this kind of a tool in our armamentarium, if you will, when we evaluate and treat patients here. Stroke is a serious problem. It's related to other conditions, for example, dementia. It's also related to cardiovascular disease, heart disease, and it's also related to other vascular problems like in the aorta and in the extremities. So all of it really has the same set of risk factors: high blood pressure, high cholesterol, tobacco history, diabetes is a big one, and those are kind of the things that we would be looking at and determining whether or not to start looking at these other problems. It's preserving life in the end. Ultimately, it's one thing to treat a pain condition, but I think it's a much bigger thing to treat the pain condition, understand the basis and treat that, and then also see the whole picture of the patient and being able to prevent stroke, to prevent aortic aneurysms, or at least detecting them and then being able to do something about them. That's the approach that we like to take here.